Hi, my name is Kathleen O'Hare and I'm a student in the RN to BSN program at the University at Buffalo. I would like to talk to you today about an important safety concern in my workplace. I chose my topic on medication adherence in the community. As an RN case manager, I see a wide variety of patients ranging from mental health issues, traumatic brain injuries, as well as your average hypertensive diabetic patient. Did you know that every 90 minutes a patient dies from an accidental overdose or a missed dose of a prescribed medication? Not only that, but it is extremely costly for the US healthcare system. It's estimated that the United States wastes $317.4 billion annually on unnecessary medical costs that relate to medication non adherence. I see many issues with patients not taking their medications properly. On average, 50% of medications for chronic diseases are not taken as prescribed. Medication non-adherence is a widespread issue, and accountability for this issue is shared by patients, their caregivers, clinicians, as well as the whole entire healthcare system. To address the problem of medication adherence in the community, all parties must work together to achieve the best outcomes for our patients. I hope that you enjoy watching my presentation. Thank you so much for watching. To ensure safe medication administration in the community, we must implement strategies to address current problems that we are facing. First, it is absolutely necessary to implement a set of safety standards. Before giving a medication to a patient, nurses must first understand the therapeutic action of medicine and the reasons for use. To ensure safety, RNs are taught to follow the 5 rights of medication administration. Right medicine must be administered to the right person in the right dose, at the right time, via the right route. If a dose of medication is not being taken by patients for other than prescribed reasons, the community nurse or case manager must consult the providers. The nurse can assure that the patient understands the information by using different strategies. The one I would like to focus on is the teach back method. The teach back method is a way of checking understanding by asking patients to state in their own words what they need to know or do about their health and medication regime. It is a way to confirm that you have explained things in a manner that your patients understand. The nurse or case manager involved in the patient's care must routinely keep up with patients. It is also vital for patients who have cognitive capacity that they should receive education on their diseases and help with advanced care planning. Next, I would suggest medication reviews. Medication management plans may help all team members involved in the patient's care to understand the patient's specific situation. This can also contribute to identifying any need for further support. A study was done to research interventions for improvement of medication adherence. Results found that interventions comprising of pharmacist-led medication reconciliation and tailoring patient education, collaborative care involving pharmacists and an automated telephone voice messaging call improved the proportion of adherent patients by approximately 15%. All medications must be assessed at each and every visit with the patient or an appropriate caregiver in any setting, inpatient, outpatient, home health, or any skilled nursing facility. Conclusions may be drawn regarding medication adherence by observing refill dates and number of pills remaining. Lastly, I would like to discuss medication organization in the community setting. Dispensed medicine should always be retained in the manufacturer's or other distributed packaging. To implement this, the nurse must identify consumers that may potentially benefit from the use of blister packs or prefilled medications. We must assess the user's ability to manage their own medication regime. In the article, Interventions to Improve Medication Adherence in Schizophrenia, it discusses that providing patients with problem-solving strategies such as reminders, self-monitoring tools, cues, and reinforcements tend to comply with medication regimes. If problems and adherence are reoccurring, booster sessions may be needed to reinforce and consolidate information. Another helpful strategy is keeping an updated copy of medications at all times. A study conducted shows a medication list for use in an inpatient and outpatient settings was compiled to improve outcomes and reduce the exposure to potentially harmful medications. Also, another study completed shows that the advantage of technology may be useful in medicine. Using text to promote self-management for patients prescribed medications was demonstrated. Patients had a high satisfaction with the text, and adherence and symptoms improved after the intervention. There are other evidence to support how text messages are benefiting from medication adherence in the community. When developing texting services for a drug alert system, diabetics and other chronic disease medication reminders, the results found that 66% found that the two-way SMS-based medication reminder service made it easier for them to track medications. Now, to bring this together, I would like to introduce a framework model that I have become very familiar with throughout my coursework. This is the PDSA cycle. This stands for plan, do, study, and act. I will explain more in the next couple slides. The aim statement that I have written up states, by September 15, 2017, registered nurses at Schofield Adult Healthcare Program will improve medication adherence in the community. After a multifaceted set of strategies, 90% of patients will always routinely be adherent to their medication regime. To measure this, I think it would be beneficial to conduct a chart audit and look back in the past assessments that we have done and check on medication compliance and see if the nurse took any action, knowing there was medication noncompliance. Also, we can just simply ask our patients about their medication adherence to see if they're taking them, if they're not taking them, and so on. For the plan section of my framework model, the RN is going to be conducting a study on 10 patients who are managing their own medications at home. Before the study, the patients will be evaluated for the appropriateness of their medication regime. There will be a medication review with the RN and the patient before the study, and the patient will be responsible for using the teach-back method so the nurse knows that the information that she is given is being understood. The RN will also teach the patient specific problem-solving strategies such as self-reminders, using self-monitoring tools, using cues, and possibly using an SMS-based system reminder, if possible. For the do section of my framework model, the RN is going to be meeting with patients while at program, weekly, and ask about medication compliance and any problems they're having and how they're doing. After that, the nurse will complete a write-up on the provided data sheets to track the progress. The study will be conducted for 2 months with a set of 10 patients. Next, we move on to study. This is where we look and analyze the data that has been collected. We determine if the results meet the expected outcome, or in other words, met our aim statement. And lastly, we move on to the act section. If positive changes are made, we would invite more patients to participate in this study and conduct it on a larger scale. If the findings are substantial, we would share our results with other community-based settings. The core values of Schofield include integrity, dedication, creativity, and collaboration. I hope sharing this study in my workplace can abide by these values and improve the care we give to our patients. Thanks for watching!